It's a really important program because it's providing basic but comprehensive healthcare services directly to children for whānau, right? So we're able to have nurses and whānau support workers in every school every day, and it provides a really useful, practical, comprehensive health service. So we know that because we hear that from kids and we hear it from whānau, but we also hear it from the schools.
Our kids are able to go to nurses and check over their health problems, issues, conditions, and able to get treated. With that, they're able to learn because they're not worrying about their health.
I had a son in Manhilary and he kept on getting infected with strep throat. So the nurse actually ended up giving him an injection of antibiotics at school. I never had to leave my house or never cost me any time, any money, which I think is great. And he was at school the whole entire time.
So kids are having relatively minor health conditions sorted out in a timely way. That means kids are going to school more, right? So really basic things like that. And we can see that it's making a difference in terms of the big things like acute rheumatic fever. We can see it makes a difference in terms of hospitalisations for skin infections.
The access for our kids to the learning is much, it's seamless, and kids can continue learning at home. So learning's changed now. It's not just learning at school. I've got kids now working on assignments and happily submitting assignments, and teaching and learning is changing, and I think Chromebooks is just making it more easier for our kids to access.
I've been into the classes and seen how the students have actually taken to those Chromebooks and are working on those Chromebooks. So it looks really, really good compared to my time when we were still pencil and paper. So
because the Chromebooks, they provide apps that we students can use to present our work on. Yeah, they're just really helpful.
My son started school at 5. He was not in a kōtuitui digital school, and his teacher was telling me he's dyslexic, he needs glasses, he needs hearing aids, he can't be taught. I moved him to one of the kōtuitui cluster schools. He was on digital learning and he's now at or above where he needs to be in his education.
The literacy levels of our children have improved significantly, particularly in the writing. And writing for Māori boys especially, which has been a long-term issue and barrier, is now starting to turn around and show that the digital learning through having one-to-one devices is actually a huge bonus for children.
And at the end of the day, it'll help them to go forward to become good community members, the knowledge that they've learnt from having these Chromebooks.
There's a group of mamas that all have children in our cluster schools, and over the last 22 months through the co-design process, we've worked at how we can help whānau in Papakura. At the moment we're working on warm, dry homes, but it's bigger than just working on the home. We're also teaching the whānau money skills and done training to help whānau within the home so that everything that we do has a better outcome for the tamariki.
We work from the middle out, so it's not Apollo agencies telling us what we want, it's us actually knowing what's best for our whānaus and working outwards and finding the proper agencies to support that.
We also have partnered with Westpac to run money skills, which has been really good for us ourselves and the community.
What is really clear to me is that it's incredibly innovative. So we've got a significant number of children in Papakura who are being touched by Mana-ā Riki in a way that will make a lifelong difference for everybody.